Hey everyone, it's Dr. Glenn Vo, and it is my privilege to introduce everyone tonight to Dr. David Epstein, founder of Wonderful Dental. Dr. Epstein, how are you doing today?
I'm doing terrific.
Oh,
Wonderful.
so Dr. Epstein, obviously we some of us know you because you post these really kind of humorous comics and whatnot. But I actually was introduced to you through Chris Hop Power, and you did like a Facebook Live in his group, and he told me about your company and about what you're trying to do. And I thought, wow, I love your mission, I love your vision, and I wanted to bring you on here and introduce you to everyone here in this group, but also talk about your company. But before I get started. I'd like to ask you what your dental background was, and then we'll kind of work from your career up to why you created this company. So let's start your career as a dentist.
Well, let me step one step back.
Okay.
I started out as a metallurgical engineer with the University of Wisconsin, and I got out of school, didn't know what I wanted to do with my life. Actually, I was traveling around the country playing in bridge tournaments. And became friends with a dentist who said, he says, with an engineering background, we actually met in an art class. We were doing paintings together. And he said, you have the right combination to be a dentist. He said, so why did you think about going to dental school? And I thought, okay, why not? So I applied to dental school, and that's how the whole thing started. But I went to Indiana University. Truthfully, I was not crazy about dentistry the first couple of years. I look back on those years in dental school as quite painful at times. But my career in dentistry really started when I walked into the children's clinic in Indiana. And at the time I was a bachelor. I had never been around little kids. I knew nothing about little kids. But I walked into the clinic and I thought, what do you do if the kid cries? I mean, I was totally in the dark. But Glenn, I will tell you, for some reason, I sat down in the chair, and for some reason, kids like me. And I don't know why, but before the end of my senior year, my classmates were sending me patients to treat. And I thought, okay, if this is my calling, this is what I'm going to do. And I applied to Indiana for graduate school in pediatric dentistry, and I got a master's degree in pediatric dentistry. But one of the things that sort of has carried me through my whole career was my background in engineering taught me to be a problem solver.
Sure.
And that's what engineering is. You're presented with a problem and you have to figure out the solution. And I sort of always looked at that in my practice, at whatever I was doing. Am I doing something that I can do better? Is there something with this procedure that can be made better? And I think that is really the basis for being an entrepreneur. I think of the guys that are on this podcast right now. If you've opened your own office, you are an entrepreneur. You looked at an area that needed a dentist, and there was a need to be filled, and you took the risk. You borrowed the money. You opened an office, and you were an entrepreneur, and you started a dental practice. And I sort of think that was the basis even for this company, Wonderful.
Yeah, and so Dr. Epstein, so you're a pediatric dentist, and you told me actually how long you practice. So I'm just going to ask you there. And there's actually a bunch of people are watching right now. So obviously, I know they're not here to see me. They're obviously here to see you. So guys, if you're on here, just let me know. Type in the comments section, wonderful, because we're going to talk about Wonderful Dental. But Dr. Epstein, how long did you practice for?
Well, I taught at UConn for 18 years. I practiced for 50 years.
Wow.
Like I told you, Nathan, I turned 75 and the guys in my office threw me out. 75 is too old to be doing children's dentistry, and so I retired. And that was 3 years ago. So,
wow. Well, congratulations on your retirement. And so we're before we kind of talk about your company, I actually there's a lot of dentists that are watching right now. They're watching right now, and probably some of them are kind of like me, who are GPs who treat the entire family. I actually see a lot of kids, and what's funny is that it used to be 50-50 in my practice, and now it's about maybe 60. No, let's say 70-30, 70% adults, 30% kids. But the thing is that all the kids grew up. So now they're adults now, they're treating them. I've been treating them since little kids, but there's some out there who are probably wondering, okay, well, I see kids. Dr. who's practicing for 50 years. What are some tips you can give the GPs that are maybe they don't have someone to refer to. Maybe they're trying to take care of all these kids that need the care, right? What are some tips as far as behavior, just things that help with behavior modification and whatnot? What are some of the tips that work for you that you can give to these practice owners who are watching right now?
Well, there's several things I can think of. The first thing I would suggest, and what I always did was, children have much better senses than adults. Their smelling is more acute, their hearing is better, their eyesight is better. And I always found with kids that if I spoke softly to a child, he would listen. I see most adults, they say hello to a child, and what do? They go, "Hi, how are you?" Well, it's like, why are you yelling at me? Because I can hear just fine. So one of the things I would tell you through my whole career is I always spoke in a very soft voice. It forced the kids to listen to me. And I think that is, it is also very calming to a child. It's less scary. I also was very aware of what I was wearing for cologne. I was very aware of how my hands smelled. And there were a lot of things I tried to look pleasant without being scary. There were several articles that I read early on in the 70s that children were more afraid of hirsute people. So men with beards and mustaches were more intimidating to a child. So I never grew a beard or a mustache or anything like that. But as far as dealing with children, I found out, I will tell you, I'm a pretty stubborn person. Persistent maybe is better. But I had a very scary incident in 1975. I remember it well. I was treating a kid in the OR, and there was a problem with the anesthesiology.
Wow.
And the child happened to be the child of a friend of mine who was an immunologist. And it frightened me. And that was the end of my doing cases in the hospital. Now, we had somebody in our office who was better trained in hospital dentistry, who took care of the cases that needed to be hospitalized, but I didn't go back to the OR. We brought nitrous into the office. I didn't like using nitrous because I found the nose piece was uncomfortable to work with. I found that the time of induction and getting the kids out took more time. And it sort of got down to, I found out that the most efficient way that I could treat a child was just to talk to him.
Yeah.
And sometimes I had to talk to him nose to nose, but basically we came to an understanding. I'm here to be your friend. I'm here to help you, but I need you to cooperate. And I had no problem with saying things to the parents like, you know what, I need him to cooperate. And if I ask you to step out of the room, okay, it will give me a chance to talk one-on-one. You're my only reward. I mean, I could promise him the x-ray machine, but he doesn't want that. He wants you.
Yeah.
So
yeah.
That was how I practiced. And I didn't medicate kids. I didn't use nitrous. I didn't put kids in the hospital. And I did it for 50 years. So
Wow.
It takes a little extra time, but in the end, you make better friends. I could number a dozen kids who have gone on to be dentists out of our practice.
Wow.
The fellow who replaced me in our practice was one of my patients since he was 3 years old.
Wow.
So I watched him grow up.
What a great story that is.
Honest to God, true story. And I encouraged him to go into dentistry, and he trained at Children's Hospital at Connecticut Children's Hospital. And we had lunch together, and I said, when you finish the program, come on in with us. And he became my replacement.
Wow,
So
that is such an amazing story, and what a great testament to you being a role model to him, and now he kind of comes in and kind of carrying on that tradition. And I want to touch base on something. And guys, if you like what you're hearing, I love hearing all these type of stories. I love that Dr. Epstein is such a wealth of knowledge. I know we're going to talk about certain things for his company, but guys, if you have any questions, pediatric questions or any type of questions, please fire away. I wanted to know more about how he treated kids. And I love the fact that, so many times nowadays, people just kind of rely on medication, right? Sometimes maybe I'll have parents come in, their kids are acting up and they're like, oh yeah, they didn't take their medication. I think to myself, wow, he's just being a kid. It's just being a kid and things like, just talking to the kids or just letting them be a kid. Those things are kind of lost nowadays, and it's kind of sad.
Kids are fun. They really are. And I could tell you stories that happened in the office that just made it a joy to go in. I have to honestly tell you, when I got up in the morning, I look forward to going to work every day. I enjoyed it. I miss it. I understand why I'm not there now, but the bottom line is that if you really enjoy, if you take the time to enjoy the kids, they are really marvelous people, and they're so much more refreshing and more candid than adults.
Sure. Yeah. Yeah. And, I want to touch base on something that you just said. You said that kids are more in tune, their senses are a little bit more acute, right? You were just saying that earlier. And speaking of which, the one thing that kids always complain about is, I don't like the taste of that prophy paste. Dr. Vo, what is that? That tastes horrible. And I'm always searching around for the best tasting one, and I can never find it. And so now I want to kind of talk about Wonderful Dental and the prophy paste and whatnot. Let's start with why. Was it because you got tired of hearing kids saying that the prophy paste tastes so bad? Is that what motivated you to kind of go into this arena, or what was the motivation there? And tell me about the company.
Basically, it goes back to a story that happened a long time ago. I actually had tried getting into this years ago, but until I had my sons involved who knew about marketing, really nothing ever happened. But if I go back a few years, I remember seeing an adorable little 4-year-old girl who came into my office. We were having a great time, great conversation. The mother was thrilled. And I went to clean her teeth. And at the time we were using a prophy paste that was supposedly bubble gum, but it was really awful orange tasting stuff.
Right.
And I started cleaning her teeth, and she didn't like the taste. She started crying. When she started crying, she swallowed some of it. And the next thing I knew, she threw up. And what started out as a great visit really went down the drain.
Yeah.
There's got to be a better way. And I went to the Greater New York meeting, and I found a manufacturer who makes prophy paste. And I said, I want to make prophy paste that tastes good. He said, that's a good idea. He said, but there's a catch. He said, I can make it for you. He says, but we make it in vats, and you have to buy 100 boxes, or a little more than 100 boxes. Well, that was 20,000 doses. I said, what am I going to do with 20,000 doses of prophy paste? And he said, well, sell it to your friends. That's how the business started. I called a bunch of my friends, and I said, listen, I've got a new prophy paste, and it happens to taste delicious. I want you to try it. And we're going to start a little company. And that was the beginning of the business. And I want to tell you, we tested.
Sorry, this is my son, Jackson. He heard there's a pediatric dentist in the house. Okay, Jackson, say hi. Hold on. All right, guys. For everyone's watching, this is my son, Jackson. Jackson, hold on. Say hi.
Jackson, you're a very cute guy. I can tell that your dad likes you a lot.
Okay, so that's actually the start of it.
Yeah, we tested 50 different chocolate flavors and 20 different bubblegum flavors. And you know what? We actually found a prophy paste that tasted great. And when I tell you, and again, this is honestly a true story. About a year ago, I had a pediatric dentist in California call me and says, you're going to love this story. I was cleaning a child's teeth with your marshmallow prophy paste, which happens to be delicious. And she says, I was writing a note in the chart. When I turned around, he was eating it out of the cup. So
really?
Yeah, and she's laughing. She says, you know what? Basically, it's dirt. It's flavored dirt. That's what prophy paste is. But we found flavors that were really good, and it takes the edge off. It makes it easier. It saves time. You know, when the kids are not pushing back all the time, it just made my life easier. And I know that even as adults, I mean, we're now making adult prophy paste, and my dentist who I go to, he practices with his daughter, who's also a dentist, and they use our prophy paste. And like the daughter said to me, she says, you know what? She says, we love your mint. The mint prophy paste is great. But she says, you know what? I got patients that love the chocolate paste.
Really? Wow. Wow.
So,
So Dr. Epstein, I'm going to ask you a funny question here. Something here. Guys, if you like what you're hearing right now, you love these stories, type in the comment section. Wonderful. So Dr. Epstein, I'm going to ask you this. If I blindfolded you and I put a blindfolded taste test, do you think you could pick out your prophy paste?
not even uh, not even a question in my mind. I know. Well, I first of all, I tested every one of our products on my grandkids, so they are my clinical tests. I always said that our products were developed in my office and not in the lab where somebody is just mixing some stuff up and sending it up. So these are clinically tested products, and for sure, I know what our products taste like, and I encourage everybody to taste everything before they put them on any kid. But I think that the fact that it saves you time and you don't get that pushback. When you have a child walk out of the office after a recall visit, you want them to be looking forward to coming back, not pushing back on the parent. When that parent walks out the desk, that mother wants to make that next visit. I will tell you, and this gets into the other thing that I pushed in my practice was I always believed the most important part of my practice was the recall system. It was having the patients coming back every 6 months for a lot of reasons. It was better for their health. It was better for my practice. It minimized the problems that we had. We intercepted problems early. I would encourage everything in my office was really focused on making sure that we got patients back for their recalls. I tried to explain to the parent. I mean, one of the things I said to parents was, I don't want to do fillings on your child.
Yeah.
I said, you never have to worry about me running out of fillings to do. I have plenty of fillings to do. Let me do them on somebody else's kids. You be smarter. You feed your kids correctly. You take care of their teeth. You come back every 6 months and have fluoride treatments, have your teeth cleaned, have them checked. That's the kind of patient I want. I said, you're the kind of person, I know you're smart. I know you want the best for your child. There are some people that all they want to do is feed their kids candy, and that's fine. I'll fix their teeth. You be smarter. And
I love that.
Yeah,
I love that philosophy. I love you saying that. I'm actually going to use that same thing. I love that, Dr. Epstein. So, we actually have some comments here. A bunch of people are typing wonderful. They obviously love what you're saying. We have someone here that says, she said she confident, wonderful. And she said, my husband is also an Indiana University alum as well. So that's somebody else there that just said that as well. So, and then we have someone that says, Doc, you look amazing. Well, there you go. All right. Yes.
One of the joys of being retired is I get to go to the gym every morning.
Yeah, I love that.
You never got to do that when I was in practice. So I used to try and go in the evening, but I was too tired. And now I get up in the morning and it makes me feel good. And
so again, for those who are jumping on, there's a lot of people watching right now. And so thanks for jumping in. If you guys like what you're hearing, type in wonderful. But Dr. Epstein just said that, he's retired now, but he had practiced for 50 years, pediatric dentist, and he just gave us a lot of pearls here. Now we're talking about wonderful dental. So we just talked about prophy paste, and I'm very interested in trying it out, and we'll talk about that later. But besides prophy paste, what other products does the company sell as well?
Well, we have varnish. We have fluoride varnish. Again, I will tell you that everyone knows that fluoride varnish just doesn't taste good.
Oh gosh, that is the word. The kids get so worked up over that. They're like, we don't want that. Like all the time, we need to put it on. So please tell me that the varnish tastes as good as the prophy paste.
It doesn't.
Okay, well, at least you're being honest.
It does. I'm going to tell you that we tried a lot of flavors, and we found flavors that mask the alcohol and the resin as much as possible. We encourage everybody to stir their varnish at least for 10 seconds to allow the alcohol to evaporate off, because that's the bitter part.
Wait. So is that go for every varnish?
Every varnish.
That is a very good tip. I know a bunch of people do not do that. Okay, so with the varnish, you want to stir it for how many seconds before you apply it?
I tell everybody stir it for 5 to 10 seconds, but 10 seconds or more is very reasonable. If you sit and stir it up while you're talking to the parent before you put it on, you allow that alcohol to evaporate off, and the varnish will taste better. but I don't think there's any varnish that tastes delicious. But you know what? I will tell you that the offices that have been using Wonderful, basically they've said this, they're getting less pushback because it does have a good flavor to it. One of the other things that we're trying to do with Wonderful is, and I will say this candidly, in 50 years of practice, I always felt like that I was a money tree in the backyard of the dental supply houses.
Yes.
And it always bothered me that, they would come in and tell me something was on special this week, but they didn't tell me that they raised the price of 5 other items that I was buying. And it bothered me that I didn't feel like they really didn't care about me as a person.
Sure,
I mean, I was a customer, and that's okay. And I liked my dental sales rep. He was a nice guy. But when I started this company, I said, you know what? I'm going to see it. There's got to be a way to make this better. And I buy products, and I don't have to mark them up the way the supply house. I don't have the overhead that a supply house.
Yeah.
Now we offer our customers prophy angles. They're the exact same angles that I used when I was in practice. And when I bought 2,500 of them, I got them for 60 cents each. And I went to the company that makes them. And of course, they didn't give me the same good price that they give the big companies, but they gave me a price that allows me to sell them for 35 cents each.
Oh, wow.
Okay, so you know what? You're saving 25 cents on a prophy angle. It's not the end of the world. It's not great shakes, but you know what? It's better. It saves everybody some money. And when you multiply that across the board, and if you're doing 20 or 30 recalls a day, it adds up very quickly. And at the end of the year, I had an office last year told me they save $15,000 on varnish.
Wow, that is amazing. That is amazing.
Varnish is 65 cents a dose. Okay, and I don't think there are many varnishes out there that are less than $1 a dose. I'm doing this as a business, and I want it to be a business. I want to be successful, but I don't feel like I have to go to the well on every dental office. And I feel like if I can save everybody some money, honestly, from my heart, that's one of my goals when I started the company. There is no reason why if you take the same product and you put the name dental in front of it, it goes up 50%.
Oh, yeah.
It's like a toilet for the Army. You remember the $600 toilet?
Oh, yeah. Yeah.
So, it's the same kind of thing. I'm dealing with my peers, with my friends, and I want to help them out. I want to stay in business, and I love my little business, and it keeps me busy every day. I talk to people. People are commenting to you when somebody calls the company, and they get patched through me. I talk to everyone. I never had a manufacturer do that for me. Nobody took the time to talk to me. So it's the philosophy of the company, and I think we're growing, and I love talking to you. It's fun.
Yeah, and I'll tell you what, that's actually one of the reasons why I want to bring you on. I love your story. I love the fact that you were a practicing dentist for a very long time, especially, you work with kids, you understand that dilemma with kids, right? If something tastes bad, the appointment goes downhill at that point. And so it's a dentist owned company. And I think many of us, myself included, we love to support other dentists in their ventures, right? Like the big guys, they make plenty of money. They do good. But, when another dentist opens a company and very passionate about it the way you are, it just feels good to kind of help out a fellow dentist. And I love the fact that, you're giving back by offering like this advice. You're creating a product that's going to make our lives easier. And you mentioned something earlier that I want to hit on. And that is, a lot of this stuff is geared towards kids, but you were saying something about you're going to do something for adults.
Yeah, as the business started to grow and more general dentists started getting on the bandwagon, buying some of our products, we heard complaints that the prophy paste, all of our prophy paste is medium grit. And they were saying, we need something a little bit more for taking stain off of teenagers and adults. And so we have introduced a new, what we call adult mint.
Okay.
It is slightly coarser than our medium, so it does a better job of removing stain. But when I was in school, I was always taught that, especially for children and equally important for adults, don't use coarse paste. Coarse paste scratches the enamel. It doesn't polish it. The second thing is that, and I was always told parents this too, that what makes your teeth white is the enamel. The dent in the tooth is yellow. And the faster you wear away that enamel, the yellower your teeth get. And that's why adults have yellower teeth than kids. Mm-hmm. And I don't want to scratch that enamel away. And also in school, I was taught that if you use coarse paste, you remove the fluoride-rich layer, which is your protection. So in answer to the general practices that wanted a little coarser paste, we made a slightly coarser paste. It is not coarse paste. It will never be coarse paste, but it is slightly coarser than our regular grit.
Does it still have the same good taste?
Absolutely, and that's
important for adults too, because they also give me the face too when I come in, and they just got a cleaning and they have that face like that tasted really gross, Dr. Vo.
I'll tell you a real quick story that an office that used our prophy paste, they were using an adult practice that used our chocolate paste, used it on a patient who was a reporter. And the reporter did an article about Valentine's Day, and she was talking about chocolate for Valentine's Day. She said in the article, she said, she says, I love chocolate. She says, I went to my dentist and he used chocolate paste for my teeth. So, you know what? And there's no reason why if an adult likes chocolate, use chocolate paste. Who cares? Our mint is a nice, refreshing mint, and we tried to pick a flavor that was not too strong for kids, but was refreshing enough for adults.
Sure.
And we've tried all of our products and tried to make them as patient-pleasing as possible.
I love it. And we have a comment here. I'm going to post this just for you. And someone just said, we ordered our sample today. We're so excited.
Yes, we offer free samples. And if you go to the website, you certainly can there's a button that says free samples. So
there you go, guys. So, I was going to save that later, but with cat's out of the bag here. And look, obviously, Dr. Epstein's talking about the great taste of the wonderful dental prophy paste. Now the varnish, maybe it's a little bit better, but he just said varnish. No varnish tastes delicious. Okay. But the prophy paste is really good. And you guys are probably wondering, man, I want to know what that tastes like. Well, go to the website and you can get a free sample. And you know what? You might be probably due for cleaning yourself. Go ahead and try it out on yourself there. And we had someone talking about your chocolate there, Dr. Epstein. And this person said, that's a great marketing idea. Chocolate paste, and let other people talk about it. Maybe talk about it for your Valentine's Day post later on in the year, right, guys? That's a great idea. So they said that there. So Dr. Epstein, website. Now, I'm going to go into how do they order this? So is it direct? Do you sell it through a company, or do you sell it direct to consumer?
Our company only sells direct. And we've had a couple of supply houses that called us about carrying our product, and I won't get because I know they're going to mark it up 100%, and I don't want that. You'll never see an ad for Wonderful in any of the big journals because I don't know what you guys are wearing. You get that beautiful big advertising journal every month. Well, add that journal, a half-page ad is like $6,000 or $8,000, and that adds to the cost for a company. And we're not going to do that. If we can save money by not doing that kind of advertising, we're going to pass it on to you guys. I will tell you that we've been in business 3 years. We've never raised our price.
Wow.
Not that we're never going to. I don't know what we may have, but at least right now, in 3 years, we haven't. In fact, to be honest with you, we're trying to bring our costs down. And if we can bring our costs down, we're going to pass it on.
I love that. I mean, it's a dentist helping another dentist there. That's what we're all about here in Nifty Thrifty Dentist. And so, Dr. Epstein, so Wonderful Dental. Okay, how long has the company been? Like, when did you start? Did you start this right when you retired, or is this something fairly new? Tell me when did it start, and obviously you told me why. But so when did it start? Number one, and who's involved? Is it a family business? Sounds like a family business.
It is a family business, and we're trying to grow as a family business. The company started a few years before we really got going. I ran into a little problem, and so I was sort of out of commission for 3 years.
Okay.
But when I got it going again, one of my sons, he happened to be watching me one day, and he says, "You know what, Pop? Let me help you with this." He started helping me with the marketing, and all of a sudden, we started getting orders, and everything is online. It is a family business, and it's getting there. So, yes, the business actually, I will say, I think that Wonderful Dental is in actuality only 3 years old, because that's when we really started doing the business.
I love it. I love it. All right. So Dr. Epstein, I'm gonna open it up again. I know a couple of people had just messaged me now. They wanted to ask you, how do you deal with the parents? Because sometimes they're worse than the kids.
There's no question about it. I always found the kids easy. It was the parents who were the problem. But again, I think things have changed a lot. When I started in practice, I think there was a different relationship between the parent and the dentist. Mm-hmm. And today, parents are a more entitled generation, and they believe that they have a right to certainly dictate the treatment of their child, and it is their child, but they have a more sense of entitlement of it, that they can be appropriate in their behavior when they believe looking after their child's best interests. But I think that it's very difficult, and I face parents like this, and I wanted to say sometimes, where did you get your dental degree?
Hey, we get that all the time from regular adult patients too.
And but today, I think that explaining to parents what you're trying to accomplish. I think I have a great line for everybody that I used in my office a lot. And I look a parent straight in the eye and I say, you know what? I want to treat your child exactly the way I treat one of my own children or one of my grandchildren. I want to give them exactly the same treatment, no more and no less. And when parents question the need for x-rays, I would say to them, I will never take an x-ray unless I believe it is needed. And I am a firm believer that you do not have to take x-rays on everybody every 6 months. If I have a child who had never had a cavity, if we went a year without taking x-rays, without taking radiographs, that was fine with me. I never felt like I was losing something by doing that. I think I gained the respect of the parents by telling them, look, you're taking great care of your child. Normally we would take radiographs at this age, but I think we're certainly comfortable waiting 6 more months, and we'll see how things look. Give parents a reason for why you're doing things. And if they don't want to listen to reason, you have to work with what you're given. And I know that we did a post recently where I was asking dentists, I was asking the people online, what do you throw people out of the office for besides refusing x-rays? And there were a lot of really good answers. I mean, the people, I think the guys are very smart, and I think they're very considerate. And when they say, I'll kick somebody out for being rude to one of my staff members, I think that's great, because the loyalty of your staff is what makes your practice. Believe me, I always said to my hygienist, I want you to tell the patient what you think the child needs. Or if you sit down and you're looking at a child that I treated 6 months ago and I did a mouthful of restorative work on, I want you to say to the parent, boy, this is beautiful dentistry. Because I can't say that, because I don't want to be braggadocious like that. But if my hygienist says it to the parent, it has a lot of weight to it. And I think when you train your staff, when guys train their staffs, you teach your staff to support you. You teach your staff to be your biggest fan club.
Yeah.
And I think parents like that. They like hearing, a dental hygienist is an expert. A dental hygienist is a professional person, and their word carries a lot of weight. So when they say you're getting great treatment, Dr. Epstein is a terrific dentist. He's great with kids. that carries a lot of weight with the parent.
Oh yeah, I love that advice, Dr. Epstein. And sometimes, you have staff members who work for you a long time, and they do like you, and they know you're doing good, and we forget that sometimes that hey, like I like to do that too with my team members. I'll say, man, my hygienist Heather, man, I call her Angel Hands. She's one of the most gentle and friendliest hygienists. We do that all the time. It makes them feel good, but it makes the patient feel good that, oh, I'm in the right place.
Right.
I want to be taken care of by angel hands. I'm so in the right place. So I love that advice, Dr. Epstein. And guys, if you like the advice, because I'm loving the advice I'm getting from Dr. Epstein right now. If you like that advice, type in the comments section. Wonderful. But Dr. Epstein, let me ask you this. 50 years in dentistry, you have probably seen the highs and the lows and almost everything that's gone in dentistry. And so for the young grads that are coming out of school right now, they're coming out with a lot of debt. I would say that's like an epidemic in our country. Just people coming out of college and professional school with so much debt, and there's so much uncertainty there. For these young dentists that are coming out, what is the advice you give to them as someone who's kind of been through a lot of things yourself in dentistry?
I will tell you that what I see happening with a lot of the young people coming out of school breaks my heart, because it puts so much pressure in their lives that it sometimes will compromise their own behavior. And, desperation is a terrible feeling. I think that one of the things I would advise people is, by all means, find a friend who is a financial person, somebody who you can talk to as a friend to a friend. Going out and hiring financial counselors is not the answer. It's just going to add to your debt. But if you can team up with or be friends with, or have someone, a family member who can give you advice on how to manage your finances, look for that help. There are ways to manage your debts, but it is scary. And I know that I read recently that after, if you're coming out of school with $300,000 to $500,000 in debt, if you produce whatever you produce, if you're only ending up with $50,000 a year, you may as well have been an electrician or with a lot less debt. So you've got to learn to manage that debt in a reasonable manner. And I think that I'm not going to disparage the DSOs at all, because I think they have a place. But again, I remember when insurance companies got involved with dentistry. Don't forget, I started before there was dental insurance. In the early 70s, there was no dental insurance.
Yeah.
And when dental insurance came in, everybody said, "Oh, this is a bonanza. Patients are going to be covered by their dental insurance." But in realism, in the real life world, you put another layer of somebody who needed to make a profit in between the patient and the dentist, and the cost of dentistry went up. The cost of providing services went up. Things like HIPAA and OSHA came into play. And so dentistry, which, when I started, two-surface filling was $20. Can you imagine? And in my lifetime, I've seen it go from $20 to what, $200, $165? And there's a reason for that. And all of these things are contributory factors. And you have to be able to manage your finances. And I feel bad that there is a lot of pressure in dentistry. And I don't have a good solution to that. But really, if I give you good advice, seek out someone who can help you with your finances.
And that's great advice, because, with these kids that are coming out, I thought I had a lot of debt when I came out, but not compared to the kids nowadays. But all that means is that you just got to be a little bit more vigilant and not compromise your ethics, right? Because it's so much easier to take the easy way out. But also what you just said, Dr. Epstein, just making sure that you don't have much room for a mistake there, right? With that type of debt. So let's just plan ahead. We all planned ahead in dental school and worked really hard. Now you're gonna have to do a little bit of planning when you graduate, so that you don't make that mistake, right? Because you don't have much wiggle room with that amount of debt. But I think that's great advice, Dr. Epstein. And you said something too about with the dental insurance coming in, that just added another layer. That was just another middleman, right, to get in the way. And that's reason why you created Wonderful Dental, because number one, you wanted to create a product that's going to help dentists, right, make the patients happy, but also you didn't want us to keep on dealing with the middleman. You wanted to sell it straight to us. So with that being said, Dr. Epstein, I know you're on Nifty Thrifty Dentist. I'm gonna put you on the spot a little bit. And guys, if you like what he's talking about today, if you like having Dr. Epstein on, type in the comment section "wonderful" here. But I can't wait to get the sample number one. I think that's and I'm ready to order some too. But I'm wondering, is there a chance you might offer a deal for our group members that, you know what, they like you, they want to help out a dentist who opened his own company too, and they really want to get their hands on that prophy paste? Can you work out a deal? Because this is Nifty Thrifty Dentist, and we're always trying to look for some kind of deal or discount in here.
Well, I was talking with my sons about this, and we wanted to offer the thrifty part of the Nifty Thrifty. we are working on changing our packaging, both in the varnish and the prophy paste. And by doing so, I think we're going to reduce our costs. And our prophy paste, I think we have the most premium prophy paste on the market. I sincerely, it's the best tasting, it's the best quality. But it's half the price of most of the prophy paste. Most prophy paste are $60 to $70 for $200. We are $30 for $200. But I'm going to tell you, we're going to change our packaging in the next 3 months, and we're going to be down to $25.
Wow.
But we have products containers right now as our original packaging. And you're on the podcast. We're going to offer everybody who so they're on the podcast and they want to. We're going to take $5 off. We're going to offer a regular $30 container for $25 to anybody who mentions it. And that'll be the thrifty part of what we're offering.
I love it.
And we're going to do that until we run out of our old product. And hopefully by then, we'll be in our new package. And everything will be $25. We are going to find a way to not raise prices every year. We're going to find a way to make what we're selling as economical as possible for everybody. And I want everybody to win. It's got to be a win-win situation. It can never be too good for one side. And it's got to be a fair marketplace. And that's what we're trying to create.
I love it, Dr. Epstein. Thank you so much for that deal. So, guy, that's $5 off of this prophy paste package here. But you know what? Dr. Epstein is so confident that you'll like the prophy paste that they're offering samples on their website. So you know what? If you want to be a little cautious, go ahead and order a sample. Try it on yourself. He just said it himself. You got to try these products yourself before you push it on some kid or some adult and say it tastes great. It tastes like bubble gum. Okay, I'll tell you right now, the bubble gum we use in our practice does not taste like bubble gum. It tastes like Pepto-Bismol mixed with something else. Okay, it doesn't taste like bubble gum, but I'm excited about that. So guys, you can go to the website, Wonderful Dental. I'll put it in the comments section, or I'll get Dr. Epstein or his son to put it in the comments section. We'll type the deal in there, order some samples. But you know what? I think I'm just going to order. I'm just going to take advantage of that deal because it sounds great. Dr. Epstein, I love what you're doing. I love the fact that after 50 years of practicing, being in dentistry, you still want to be in dentistry. That makes me feel good. I'm 12 years in, but hearing your story, I'm like, wow, there's 50 years and he's still going back. That makes me feel good. And I think a lot of dentists are watching right now, makes them feel good too, because, dentistry can be tough, but it's good to see, trailblazers like yourself say that you still love dentistry, you still want to be involved. So Dr. Epstein, I am going to let you have the final word before we log off here. The final words to all our viewers right now?
Well, I will tell you, I love learning from you guys. And doing this business has done two things. It's forced me to go back to school and research things because you ask me questions that I have to find the answers to. But it also has allowed me, when I first started, I always viewed that I would eventually go back into teaching. But at 75, I wasn't going back to teach at the university. But being online and talking on the phone with you young guys, it's been absolutely a joy. And if I feel like I can offer something that will teach you something, it is my pleasure. And I want everyone to know I am available. If you call our number, I'm going to pick up the phone. And if you have a question, whether it's about prophy paste or varnish or whatever, if I have an answer, I promise I'll give it to you. And I'll give you the answer that I think I have, to my knowledge, is the best. I'm not going to make up things for you.
I love it, Dr. Epstein. And you know what? I can't say anything else to top that. So guys, thank you so much for jumping on and watching us. And Dr. Epstein, thank you so much for coming on and hooking our group up with that discount, but also sharing those pearls of knowledge. We appreciate it.
Well, you're fun to talk with, and I've enjoyed this immensely. So you're doing a good job.
Thanks. Thanks, everyone. And we'll see you guys later.